Welcome back to my channel. And if you're visiting this space for the first time, you are also highly welcome. In this lecture, I'll be looking at the gluteus minimus. We try to use this image by the side. This is where we have the gluteus minimus here, carried in black. This muscle is the most deeply embedded muscle within the gluteal space. And in this lecture, we'll be highlighting the details on how the fibers of this muscle originate and where they are finally inserted upon. Would also be highlighting some features that you should know as students of anatomy. So ride on with me. The gluteus minimus is the smallest and also the deepest muscle within the superficial gluteal space. This muscle is what is seen to be highlighted here in red. This muscle is a fan-shaped muscle that is located within the superficial gluteal region. If you go back to our lecture on the gluteal region, in that lecture, we highlighted that the muscles around the gluteal region are further subdivided into two compartments. We say that we have the deep compartment and also the superficial compartment. The deep compartment is what is seen to be embedded within the gluteal region, just as the name implies. So we have a number of muscles, coming together to form the deep compartment of the gluteal region. And in this compartment, you see that they are embedded deep within the gluteal space. Then we have the superficial compartment, just as the name also implies, it is superficially placed. So you see the superficial compartment overlying on the deep compartment. So within the superficial compartment, we have the gluteus minimus as the most deeply embedded muscle. And this is what is highlighted here in red. If you go back to the deep compartment, in the deep compartment, we have the piriformis. This is where we have the piriformis here highlighted in blue. The piriformis is one of the muscles that make up the deep compartment of the gluteal region. And this piriformis is seen to form the same alignment in terms of topography with the gluteus minimus. If you look at the gluteus minimus on this other side, even though the gluteus minimus is one of the superficial compartments of the gluteal region, it is seen to be placed forming an alignment with the piriformis that is one of the structural components of the deep compartment of the gluteal region. And this is what is exhibited here in this image. And it is important for us to highlight this fact. But the fact that we say that the gluteus minimus is one of the structural components of the superficial compartment, this muscle is still seen to form an alignment with the piriformis. So they are placed on the same level, even though it is classified as one of the structural components of the superficial muscles. This gluteus minimus is then further seen to be overlined by the other gluteal muscle. And it is important that we highlight this. So this is the gluteus minimus as we have initially highlighted. So this gluteus minimus is seen to be overlined by the gluteus medius. And this is what is highlighted here in green. This gluteus medius is then seen to be overlined by the gluteus maximus. And this is what is highlighted here in purple. So you see that the gluteal muscles are seen in layers around the superficial gluteal space. So we have the gluteus minimus being deeply embedded, and this is overlined by the gluteus medius. Then finally, more superficially, we have the gluteus maximus, and this is what is seen here in this image. On the lateral edge here, we have the tensor facial lata. This is what is seen to be highlighted here in yellow. This tensor facial lata is seen to be laterally placed within the superficial gluteal space. So all these muscles, the gluteus minimus, the gluteus medius, the gluteus maximus, and also the tensor facial lata form the superficial compartment of the gluteal region. This we have highlighted in details in our lecture on the gluteal region. You can go and check that lecture up to keep yourself updated. While in the deep compartment, we have the piriformis that is highlighted here in blue. We also have other muscles which include the obliterator internus, the superior and the inferior gemini muscle, and also the quadratus femoris. These 5 muscles are seen to form the deep compartment of the gluteal region. But it is important to note this fact that the piriformis is seen to run in the same level with the gluteus minimus. Even though the gluteus minimus, we say that it is classified as one of the muscles in the superficial compartment of the gluteal region. So let's dive into how the fibers of this muscle originate and where they are finally inserted upon. The fibers of the gluteus minimus are seen to originate from the gluteal surface of the ilium, If you look at this image by the side, this is the posterior view of the bone in pelvis. And we know that the fibers of the gluteus minimus will be originating from the posterior surface of the ilium. This is also referred to as the gluteal surface. So this is the posterior surface. And on this posterior surface, it is important that we highlight some distinct features that will help us in understanding the basis onto which these fibers will originate. So if you look at the posterior surface, we have a number of lines around the gluteal surface of the ilium, and this is used to mark the point of origin of the gluteal muscle. If you look at this region, at this lower head here, we have the inferior gluteal line. This is a prominence that is created around the inferior region. Then if you go more anteriorly up here, you have the anterior gluteal line that is harrowed here in blue. This is also a prominence that is created on the gluteal surface of the ilium that is positioned around the anterior region. Then if you go more posteriorly behind here, we have the posterior gluteal line. So you have a number of prominences created around the gluteal or the posterior surface of the ilium. And it is important that we highlight these lines because this is what we'll be using to establish the point of origin of the gluteal muscle. So if you look at the other side of the image here, we also try to create this alignment around this point. So if you look at this region here that is demarcated here in dotted red, this is where we have the inferior gluteal line. This is where we have the anterior gluteal line. And if you go more posteriorly behind here, we have the posterior gluteal line here. So you have these lines here demarcated in dotted red, dotted blue, and also dotted yellow. So we have specific regions of these prominences created and are so named based on the region of the gluteal surface that they are positioned. So if you look at the inferior region, we have the inferior gluteal line because it is inferiorly placed. And if you go more anteriorly to the front, even though it is still located within the gluteal surface, it is positioned more anteriorly, and this is the anterior gluteal line here highlighted in dotted blue. Then if you go more posteriorly behind, you have the posterior gluteal line that is highlighted here in dotted yellow. So going back to the origin of the gluteus minimus, the fibers of the gluteus minimus are seen to originate between the inferior and also the anterior gluteal line. Remember, we already created this demarcation here. The inferior gluteal line demarcated here in dotted red, and the anterior gluteal line here demarcated in dotted blue. So in between these two lines is where we have the fibers of the gluteus minimus originating from. And this is how they originate and are finally inserted on the anterolateral surface of the greater truncata of the femur. This is where we have the greater truncata of the femur here, harrowed in black. This greater truncata is also an elevation that is created around the head of the femur. This is where we have the greater truncata, and this is where we have the lesser truncata. The head of the femur is what is fixed into the acetabulum at this point where this arrow is pointing. You see that the fibers are emerging from the gluteal surface of the ilium, specifically between the inferior and also the anterior gluteal lines. The fibers are seen to converge here on the anterolateral surface of the greater truncata of the femur. And this is what is exhibited here in this image. It is also important for us to add that we have the truncateric bursa. This is the truncateric bursa here that is located deep between this gluteus minimus and also the greater truncata. This is to allow free movement between the muscle and also the bone that is projected here at this point. It helps to reduce friction between this muscle and also the bone that is related to it around the space. So let's look at the actions of this muscle. The gluteus minimus in our previous slide, we already established the details on how the fibers of this muscle originates and where they are finally inserted upon. The actions of this muscle include that they help in abduction and also medial rotation. If you go back to the insertion point of the gluteus minimus at this point, we say that they are inserted on the anterolateral surface of the greater truncata of the femur. This is where we have the anterior surface in the anterior side, and on the lateral edge is where the fibers will be finally inserted upon. This means that this muscle will be able to exert a rotation that will be directed internally or medially. Most times, if you look at the point of insertion of the fibers of muscles, you'll be able to justify why some actions can be exerted. So because they are inserted on the lateral edge, on the anterior surface of the greater truncata of the femur, they are able to exert medial rotation. Medial rotation is internal rotation when you rotate towards the inward direction. So this is one of the functions that is exhibited by the gluteus minimus. They are also seen to help stabilize the hip. If you look at the pattern that the fibers of the gluteus minimus run from where they originate from and their point of insertion, you see that they are also seen to be crossing over the hip joint. And because of this, they're helping to reinforce and also stabilize this joint. So if you look deep here, you see that the head of the femur is fixed into the acetabulum. And because they are crossing over it and finally inserted on the anterior lateral surface of the greater truncator of the femur, they will be seen to help in reinforcing and also stabilizing this joint. So this function is also exhibited by the gluteus minimus. But the blood supply of the gluteus minimus is by the superior gluteal artery. The superior gluteal artery is a branch from the posterior trunk of the internal iliac artery. We also tried to highlight this in our previous lecture on the internal iliac artery. In that lecture, we described that the internal iliac artery is further subdivided into the anterior and the posterior trunks. And we have branches from the internal iliac artery emerging from both the anterior and the posterior trunks. So specifically, it is from the posterior trunk that we have the emergence of the superior gluteal artery. And this artery is seen to be providing supply for the gluteus minimus. Why the innervation of this muscle is from the superior gluteal nerve, just a corresponding named nerve. And the superior gluteal nerve is one of the branches from the sacral plexus. So this is what provides innervation for the gluteus minimus. So going to clinical anatomy, there could be weakness of the gluteus minimus and also weakness or damage to the innervation of this muscle. And we know that this muscle is innervated by the superior gluteal nerve. And when this occurs, this will result into pelvic drop. So there's going to be a sagging of the pelvic region. If you look at this image on this side, this structure that is highlighted in red is the gluteus minimus. And an alignment, of course, is created by the pelvic bone. So when there's weakness of the gluteus minimus, there's going to be the loss of action of this muscle. And remember that one of the actions that we highlighted is stabilizing the hip joint. And this is going to lead to pelvic drop, which is a sagging of the pelvic region. The pelvic drop will occur on the contralateral side of the region that is damaged. So when there's damage on one side, the contralateral side will be seen to be deviated. And also when there's a damage on this side, it means that the deviation will be seen on the other side. Thanks for watching this video. Let's continue to stay glued to this channel.